And I have my very good friend here, Brian Mwendwa, who's a doctor. He's a rapper as well. And he's on the line with us. Good morning.
Good morning.
How are you doing?
I'm good. Yourself?
Us guys are good. We are thanking God, man. Tunafanya to social distancing.
Poleni sana. You guys are also essential workers, so big up to you guys as well for keeping people entertained,
Thank
while
you,
they're
thank
locked
you.
down.
Thank you. So, Doc, I want to just get right into it. Of course, today on the show on Corona Diaries, we're celebrating the health workers, and I know that you've been working. Tell us, how long have you been working so far?
Well, I've been working since, so nothing really has changed for me.
Mm-hmm.
Things go on. We've been on the front line.
Yeah.
Some hospitals are now isolation centers for
Yeah.
COVID-19.
Mm-hmm.
So it's pretty much mixed feelings. It just depends. Honestly speaking, it depends on which sector you belong to.
Yeah.
And also it depends the type of hospital management and how they are taking it. For a fact, for those who I've been really proactive on my Instagram and my socials, because I feel like other than just treating people, it's very important for us to share the information to the public.
Yeah.
Especially since there seems to be a disconnect whenever CS gives information. There's always a lot of questions.
Yeah.
Just recently, I got a lot of questions about the issue with masks and which masks help you. Do the cloth masks protect you? So a lot of people are confused. There's a lot of information to digest.
Yeah.
From these daily updates. However, we are still not optimally equipped. This was expected.
Yeah.
I mean, our healthcare system in Kenya has been far from optimal for a very long time.
Yeah.
This has been evident from all the strikes that the doctors have had, the dentists, the pharmacists, the nurses, the clinical officers.
Yeah.
All of these people have been complaining about the healthcare system and the government's efforts to ensure that the facility, are top notch, that we have all the equipment, which we don't have.
Yeah.
So basically what's happening now is that there's it's a big panic because you're trying to do things last minute. Corona is here.
Yeah.
You don't have certain things. So of course it's going to be a bit of a mess.
Yeah. And
I do, however, commend the government and the measures they're taking.
Yeah.
It's just that on the ground, things are a bit different.
Yeah. And we can understand that. Looking at the dailies today, they're saying that the rapid testing kit is coming in 2 weeks. So we're just trying to figure out, okay, how are they doing the testing so far? But I don't want to get into that because we know we can do that. But as a healthcare worker, you've been working, like you said, but things are a bit different right now. What's the mood like in hospitals for the health workers?
Well, healthcare workers are very anxious. We do put a brave face for everybody so that we can just do what needs to be done.
Yeah.
But like I said, if you're working in a hospital where you have very good support from your hospital management, where you have actual provisions of all the PPEs, you have good training and preparedness, then the anxiety is just a little bit, not exactly excluded, because having these PPEs does not guarantee your safety. It just minimizes the risk significantly.
Yeah.
So where there's a lot of anxiety is public institutions where the PPEs have not yet arrived. So the CS said that in 2 weeks we can expect everyone to have PPEs. They should have produced 200,000 PPEs for everybody. But you see, within 2 weeks, you're still asking some people to go
risk
to work
their
who are
lives.
not, to risk your life. So you ask yourself, are we being celebrated for being heroes?
Yeah.
Or are we being celebrated because we are actually adequately protected and we're serving? Because if a soldier goes to war and he doesn't have a gun and he knows you're probably going to die without the right ammunition, do we call that soldier a hero, or do we say that the system is flawed?
Yeah, and but there seems to be some green, some green light at the end of the tunnel, because the CS said that when it comes to health workers, because I always ask myself, you're there at the forefront, you're at the hospital interacting with people who probably have COVID-19, but you still have to go back to your family at the end of the day because they weren't providing accommodation. But now they're talking about giving accommodation. Is this good news, or is this now more stressing?
No, this is definitely good news. It's going to be more stressing because you're going to be away from your family, but it will protect them. So, like I said, they are taking good measures, and they're taking good steps. I do commend the ministry in the steps that they're taking.
Yeah.
It's just the rate, but I understand. You need to understand that some of these things that we're expecting the government to do is a bit hard because we are already a very, very weak healthcare system.
Yeah.
So when people start complaining about, they got quarantine and the quarantine facilities, which are basically our public boarding schools, they don't have good sanitation, there's no running water. You need to remember these are boarding schools that we take our kids to.
Yeah.
So this has been happening. Teachers have been striking about their schools and the situation that's been. So I guess it's just a wake-up call.
Yeah.
We shouldn't be so hard on the government. I would say please follow the recommendations by the Ministry of Health.
Yeah.
All of those, all the measures they're putting into place are all science-based evidence. They're all recommended. It's going to be hard. Things are not going to be business as usual.
Yeah.
And that's what we need to understand, that we're not Italy, we're not Germany. We are a very, very poor third world country when it comes to infrastructure of healthcare, education, and any emergency preparedness, any natural disaster. We are not ready, actually.
Yeah. Okay. And, now I was talking to my MVPs earlier and I was like, now you understand when healthcare workers go on strike and they say that we need better healthcare system. It's just sad that it had to be, via experience to learn. As I let you go, Doc, is there any specific message that you'd want to give Kenyans? Because you are at the forefront. Is there anything that you'd love to reiterate to Kenyans? Just as maybe they've heard it before, but what's important for you in this Corona time that Kenyans should know?
What's important is that people take the right measures. So the basic measures, which is make sure that you wash your hands every 20 seconds for 20 seconds with soap and water. It's very important. Sanitize when you can sanitize. Please, please, please stay at home. If you can work from home, work from home.
Yeah.
If you are going outside, it shouldn't be to do something idle. It's either to get essential things such as groceries and bring it back home. If you absolutely must leave the house to work, maintain the safety measures, social distancing, wear a surgical mask. The surgical masks are only if you are sick or if you're suspecting that you could have it. Otherwise, you just use your cloth mask when you're boarding on public transport or when you're going to be in the supermarket, your glucose, your toys, which I don't really understand what you'd be doing at this time. But just follow whatever the government is saying.
Yeah.
So far, so good. Us guys as scientists and healthcare workers do agree with everything they're saying, and it's based on science. So just follow what the good CS is advising us to do.
All right. I appreciate you, Dr. Brian Mwendwa, and thank you for fighting this good fight for us as Kenyans. I appreciate you.
Thank you. Have a good day.
You too.
Vibes Radio, we rule the nation in this generation.